Yep. Flu season is right around the corner and new COVID-19 variants are expected to emerge in the coming months. This as more Illinoisans become eligible to receive booster shots and as the FDA considers full approval for the vaccine for children ages 5 to 11. And joining us to discuss the latest COVID-19 developments is Dr. Ngozi Ezike, Director of the Illinois Department of Public Health. Dr. Ezike, thanks for joining us as always.
Thanks so much for having me.
So as we mentioned, flu season is coming. There are other seasonal viruses that are showing up right now. Are you worried about a bump in cases and a potential co-pandemic as we head to the colder indoor months?
That's always been a concern. Of course, last year we were very fortunate. There was essentially no flu season. We don't know that that will be the case this year. And so, of course, we have our flu shot that is out there. And the good thing is that you can get your flu shot and your COVID shot at the same time. They can be co-administered, so you don't have to have two separate visits for the first of each, and then follow up with either maybe a second dose if you get an mRNA vaccine. But absolutely, we want to avoid a possible twindemic, if you will, of flu and COVID by making sure that we get fully vaccinated for both as soon as possible.
And speaking of those vaccines, a booster shot has been approved. Who do you recommend the booster shot to in Illinois? And what do you think the demand will be?
Yeah, so we have already seen some people proceeding to get that third or that booster shot. Of course, the immunocompromised, that was already put out there about a month ago for anyone who fits into that immunocompromised category to get the third dose in the series. But now with the recent CDC announcement last week, we see the highest risk category that should absolutely pursue getting this booster are individuals over the age of 65 who started off with that Pfizer series, and long-term care residents. Those individuals should absolutely 6 months after their initial Pfizer series get that booster. As well, people who are slightly younger than that, not quite seniors, up to age 64, 50 to 64, but you have those serious underlying medical conditions, which we have seen portend a worse course with COVID. We recommend strongly to get that booster as well. And so those are the groups. Absolutely, you should get that booster 6 months after the Pfizer series. And then the rest is more, assessing your individual risk. And then after that, if you're in a high risk setting where you think you're constantly exposed to the virus, constantly exposed to many people, maybe many of whom are not vaccinated, then you might say because of your setting that you want to get the vaccine. Or you could just say that, I'm not 50 years old, but, I'm an adult that does have a significant medical condition. And because of the risk associated with that condition, I want to take advantage of the booster as well. So again, a lot of individual choice and risk stratification for individuals is at play in this case.
Speaking of unvaccinated, Pfizer has submitted data to the FDA showing apparently that the vaccine is safe and effective for children 5 to 11. Approval could come in the next month or so. Would you be in favor of vaccine mandates for public school children once this is approved?
I think probably we might see an emergency use authorization before the full approval. Again, we are really working on, keeping the healthcare resources fully available, unlike some places where we're seeing problems like in Southern Illinois. So I think if we can really, first priority is those adults to be fully vaccinated. Fortunately, kids aren't the ones that are hardest hit with COVID, but of course we want to encourage vaccination. Vaccinations are a fantastic modern health technological aid that really helps prevent sickness, prevents death. And so we want to encourage it for everyone. I don't see that mandates will be happening, for this school year, but I think that people will just do the right thing and pursue that vaccination as we see how it helps curb this pandemic.
Speaking of schools, Dr. Ezike, there's some concern in CPS of mini outbreaks. Your own department has data showing that 2,000 young children have reported COVID-19. Are you confident in the mitigation and the monitoring efforts of CPS and other school districts to manage these little outbreaks?
Yeah, I think we all know the tools that will help us best manage these outbreaks. We know that you have to have a combination of vaccination, masking, and then testing, and the contact tracing. And I know that all of our school districts are working with our local health departments, to get this important work done. We are learning, there are articles that came out just last week about how masking has significantly decreased the number of outbreaks in schools that had mask optional versus mask mandatory. We have seen that divide in terms of where more outbreaks have happened. And so I think following the guidelines that we've been preaching for quite a while now, we can keep those outbreaks to a minimum and keep that school environment safe for in-person learning.
Well, as you know, here in Chicago, Mayor Lori Lightfoot has given the green light for a citywide vaccine mandate, regardless of some resistance from union groups. Let's take a listen to what the mayor had to say recently.
We absolutely have to have a vaccine mandate. It's for the safety of all involved, particularly members of the public who are interacting with city employees on a daily basis. It's important for colleagues to also feel like they have a workplace that is safe. So a vaccine mandate from the city will come, and we'll make specific announcements in the coming days.
Dr. Ezike, you've seen in New York, tens of thousands of healthcare workers refused to take vaccines before the mandate went into effect. Do you see any kind of resistance like this in Illinois?
We always hear from that vocal minority. The truth is the majority of Americans actually support mandates, and I even before they started rolling out, and the majority of healthcare workers, of all these different sectors, teachers, support getting vaccinated and know that this is the way to protect our work environments. And so I know that we'll get some pushback, and of course you're never going to have 100% consensus on any issue. So of course there are going to be people who will push back, but I think the majority of the people are on board and in line, and we are going to get lots of people vaccinated because that's the way we get out of this pandemic.
All right, Dr. Ngozi Ezike, we thank you as always for taking some time out and joining us. Thank you so much.
Thanks so much.